You're watching Reality Check. Now, both mega cities, first it was Mumbai, Maharashtra, now Delhi, has placed price caps on private hospitals. The allegation being, or the suggestion being, that private hospitals are overcharging, are trying to profiteer from a pandemic, and so the rate of COVID beds has been brought down. Look at what Delhi has done. Isolation beds in Delhi from 24,000, about an average price at a private hospital, now will be between 8 to 10,000. ICU beds from 34 to 43,000 now will have to be made available between 13 to 15,000 rupees per day. These are all per day charges. ICU ventilator beds, which were being offered at between 45 to 55,000, down to between 15 to 18,000 rupees. Now, what do these prices include? As per the Delhi government, it includes the cost of safety wear, that is PPE kits are included in this, as well as beds, food, monitoring, nursing, doctors' visits, imaging. All of this is included in the capped prices. What is not included? Remdesivir. These are all experimental therapies. This is not included, as well as diagnostic tests. And just to remind ourselves, Mumbai had done the same several weeks ago. When I say Mumbai, I mean Maharashtra. They had capped prices of both COVID care as well as non-COVID care. This is the price cap for COVID care in Maharashtra. Isolation beds for between 7 to 10,000 rupees, capped at 4,000 rupees. ICU beds from between 20 to 50,000 rupees, capped at 75,000 rupees a day. Ventilator beds between 30 to 60,000 rupees, capped at 9,000 rupees a day. So almost a drop in 3 times the price of these beds. But is this going to work? Is this actually going to lead to hospitals now offering lower cost beds, or is there going to be also a question of the quality of medical care that is being offered? That's the question, because private hospitals have long argued that they're not simply profiteering. The kind of high quality care that they're providing at ICUs is something that comes at a price, and that's not something you can easily replicate. Okay, joining us tonight on Reality Check, we have with us Dr. Sujit Chatterjee. He is the CEO of the Hiranandani group of hospitals in Mumbai. We have with us Vivek Nangia, who's a pulmonologist. He's joining us here in Delhi, is on Reality Check tonight. Dr. Vivek Nangia is Principal Director and Head Respiratory Care, Critical Care Medicine, Max Saket. We also have with us Malini Aisola, co-convener of the All India Drug Action Network, and Raghav Chadha, MLA and spokesperson, Aam Aadmi Party. Thank you very much indeed, all of you, for joining us. So if I can just start with you, Dr. Sujit Chatterjee, that is this price cap, is this realistic? Can you actually, firstly, are these beds now at your hospital you're putting them out at government capped prices? Is that correct? And are you able to provide the same quality of care?
Well, let me just start off with saying one thing, and I'm just taking a leaf out of what you've said, and that is Maharashtra started this capping way back on the 21st of May, this year. So therefore, what Maharashtra thinks today, possibly India thinks tomorrow. I must make that statement. And the other thing that you said is that we try to profiteer. Well, it's not profiteer. It's to ensure that every unit is self-sustainable. Now, the charges which have been done by the government of Maharashtra have been actually in consultation with the private player. So therefore, we were on the same page, and they have also been extremely reasonable to take out a lot of procedures. For example, in Delhi, you've included the PPE, but Maharashtra has not.
Right.
So therefore, though the charges are far lower than Delhi's, but then we have a leeway somewhere where we can just about make up what the cost is as far as the private hospital is concerned. But this is also what the government tells us, and we have no reason not to believe them, that they say that this is for the COVID time. So therefore, everybody is tightening their belts. So are we. So therefore, I would like to liken.
No, but I just want to ask you
this.
No, but
you know,
Dr. Chatterjee. No, let me just understand something. If you're saying that, just try to simplify this for the viewer. If your argument is that the capped prices are reasonable, you don't have a problem with the manner in which prices have been capped, then some would question why you were charging those high rates to begin with.
You didn't let me finish. I said that at this particular point in time, we were tightening our belts because the country is at war. We have an external threat, we have an internal threat. The internal threat was COVID. So therefore, we are working with enormous constraints, but we will never, ever let the quality of care go down despite all the difficulties that we face. So therefore, the private players are doing an absolute sterling job, despite all the difficulties that we have.
Okay. Dr. Vivek Nangia, you are actually in the front lines. You are looking after critical care at Max Saket, which is one of the most sought after ICU units in Delhi. Price caps have kicked in Delhi as well. Is it possible? I mean, the same question to you. Is it possible to provide the quality you were providing earlier now with the price caps?
So, Srinivasan, at the outset, I'd like to admit that I'm not from a financial background, nor do I understand these finances very well. I'm a pure clinician, and whatever I'm speaking today is only from a clinician's perspective and a doctor's perspective. And this is with all due respect to the government of the state.
Right.
And that I'm sure they would have done their due diligence before they rolled out these price caps. But I would only want to say one thing here, that, you know, this is capping the prices right now is tantamounting to literally demonizing the private healthcare. You know, trying to say that the private healthcare has been profiteering all this while, as you rightly said yourself.
Right.
While actually, if we look at the statistics, and again, I'm going by the media reports, that private healthcare is actually bleeding at this moment. So the time is here to support private as well as public healthcare to boost their morale and not let them go down like this. There is, I feel there is some degree of short-sightedness here, because even if you see the FICCI report, they've also said that price capping may not be sustainable for a very long period. You know, when it comes to, say, a mild disease, yes, there is no problem. Such patients can actually be managed at home with just some simple medicines like paracetamol or this new drug which is orally available, and they can be used and it doesn't cost much really. So there it is applicable. But when it comes to a high-end ICU care, you know, let me give you an example that a patient comes with, say, an underlying kidney disease and now needs dialysis. For dialysis, you need to put on a catheter, there are charges of the catheter, and then there are charges of the dialysis per se also. And that, I'm sure, is included in the same package, which becomes very difficult to manage. Then what if this patient develops they have other comorbidities as well, for which, again, there's a higher cost of those medicines also involved, which has also been included in the same package. Then comes, what if this patient develops a complication?
So you're saying that it's a domino effect?
Absolutely.
Right. You're saying that could be a cascading effect. What happens if those complications develop? But let me just ask you a question. Let me ask you a practical question. As someone who's a frontline, as you said, you're not on the corporate side. You're someone who's actually hands-on.
Right.
What does a price cap actually mean in terms of the practical implementation of it? Does that mean you start cutting back on the kind of, the sort of the quality of the medicines you provide? Do you switch from branded to generic? Is there cutting of corners? How is it actually working?
Yeah, that is exactly what I was coming to next. You know, that when this patient develops a complication and you want to use high-end antibiotics, now what do you do in a situation like this where there's a capping? Would you be able to use it or would you not be able to use it? The antifungals, some of the antibiotics cost 3,000, 4,000. The antifungals may cost up till 8,000, 10,000. Then there are certain medicines which are used to control the inflammation, which are a apart from these experimental drugs which you said, plasma therapy, besides these, there are certain other drugs, certain other filters which are not purely experimental, but you may want to use them to control the sepsis. But so what would you do in a situation like that?
What
then
would
again,
you do, sir?
in a patient who's critically ill?
No, I'm asking you,
Sorry?
what would you do? What would you do at Max? Dr.
So
Nangia,
probably what we'll have to do
would
is
you do at
either
Max?
seek permission from the...
You have that
That's what I'm
choice
saying.
now
So
in front of you. Yeah.
So either we seek permission from the government to allow us to use these extra therapies at an extra cost, or we take consent from the family members and say that, okay, this is what the situation is, and we would want to use these therapies. If they agree with this, then we go ahead and do them. But if our hands are tied, then we possibly can't be managing the critically ill patients. You know, then again, the cost of consumables is very, very high in these patients. And when a patient comes to a private healthcare, they have certain degrees of expectations.
Yeah.
You know, where you cannot compromise on.
Okay, you're making a broad spectrum of...
completely.
Okay, fair enough. Let me... You're making a lot of points. I need to go to the others. I'll come back to you. Malini Aisola, you know, your network is amongst those that's been very strongly campaigning for reducing capping prices. That seems to have happened at least in these cities. How would you respond to some of the concerns raised by Dr. Nangia?
So Vasu, let's remember that this discussion is actually a consequence of a long-standing issue, which is that the governments have been reluctant to rein in the private sector. And the corporate lobby, as we know, has been running around unchecked and been exerting very large amounts of undue influence. I think what we're hearing from the other panelists is that there are claims that, you know, there will be, the hospitals have undertaken a lot of losses. And surely, you know, we understand that everyone has suffered hardships, but it is extremely unethical for hospitals to be thinking about profiteering off patients. And they should really, this is the time during a pandemic when they should be thinking about a break-even model. Some of the claims of the hospitals are absolutely ludicrous. They have been claiming that there have been increased costs due to PPE, due to you know, new arrangements for biomedical waste disposal. In fact, all of these costs are actually offloaded onto the patients. I mean, if some of we can go through other kind of claims. So, for example, Max Hospital put out a press release saying that, you know, the costs have gone up because they're having to keep their doctors in 5-star accommodation. In that case, why aren't you putting specifically that cost in the bill of a patient? And then if you did that transparently, we'd be able to have a better debate. Also, I'd like to point out that new avenues for business have opened up. So, for example, all the hospitals are now indulging in decentralized models such as use of telemedicine, also home care packages, which are frankly, you know, another form of profiteering and making money. Isolation facilities that are, you know, upwards of 10,000 rupees a day. And if we just go back to, you know, the track record of
Malini,
Hiranandani, yes.
Right.
Can I just finish my point?
Yes, but Malini, very quickly, because I have to go to... Yeah.
So the first is that Hiranandani
is a hospital that has also
been caught red-handed for profiteering. For example, it has charged upwards of 6,000 rupees for just a test, a COVID test, even though there was a price cap at the time of 4,500 rupees. And what the gentleman on the panel is talking about is really referring to loopholes in the Maharashtra prices that allow for overcharging even with the rate caps. We can discuss that later. And Max, of course, is very famous now because they put out a rate chart that was reflecting, you know, high levels of profiteering again. And now they are making threats about endangering lives of patients because of the government's price caps.
Okay, let me get them to now respond, Malini. Let me get them to, because now you've specifically named, I was actually having to come to Raghav. Raghav, if you'll have to permit me, I'll have to quickly get a response from you know, both Dr. Chatterjee and Dr. Nangia. Dr. Chatterjee, if you want to respond to what Malini said. Yes.
Yes, I would like to go first because this question about us charging more, it wasn't us charging more. We charged exactly what the price cap was. But at the same time, the question was that you consulted a doctor. Now, in the fever clinic, you have a senior consultant, a pulmonologist, sitting for consultation. So you've got to pay the doctor's fee. It is not just the COVID test. The COVID test was exactly charged as per the norms at that time, which was 4,500 rupees. But at the same time, there's a senior consultant, a pulmonologist sitting there. One of my co-panelists is a pulmonologist. And just ask him, would he not charge for a consultation? So am I not justified in that consultation? The other thing is that I'd like to point out is that the government of Maharashtra today also has excluded certain high-end drugs like immunoglobulins, meropenem, etc. So therefore, it is not profiteering, sir. The word that you want to use is that break-even fine.
Let me just get.
That's exactly what we are doing, sir. But
let me just
say that we were charging more is absolutely incorrect.
Let me just get Dr. Nangia to respond to the point about Max.
Right.
Dr. Nangia, very quickly to the point that Max was overcharging, and now you're kind of threatening to say, listen, if you're not charging the full rates, we'll have to roll back on the quality.
No, there are no threats. We are still committed to provide the best standard of care to all our patients. Even if we are, going in a negative balance, that's okay. But we will still provide that kind of a care to all our patients. I'm only trying to say that, when Max displayed their tariffs, that was a part of their transparency policy. That if the patient is coming and getting admitted, they have it all before them, before they're getting admitted themselves. Second thing is that
it was mandated by the government.
Exactly. So that was transferred. It was shown. No, I don't think any other hospital has actually gone and taken that step. So that is what
Raghav Chadha. Raghav Chadha. The irony here is that you have situations where state governments are going after private players, saying that you need to cap prices, and you may well have reasons to suspect that there could be concerns there, and you may want to intervene. But the problem is that look at the quality of public health care. Why do people run to private hospitals? Even, I'm sorry to say this, your own health minister had to get admitted to Max. The dean of RML, government hospital in Delhi, had to get admitted to Max. So how would you respond to that? That on one hand you say, okay, bad guys, cap prices, but when it comes to the crunch, everybody wants to go to a private hospital. You pay more because you get better quality.
Look, Vasu, the Honorable Chief Minister has said this on a number of occasions, and I'm going to say it again on your show, that we feel that both the government hospitals as well as private hospitals are in partnership at this point in time, are together fighting this outbreak of COVID-19, and we absolutely recognize the private sector's critical role in dealing with this pandemic and providing quality healthcare. However, it was felt that profiteering by fleecing people is not the right way to approach this. I'm not painting, all this with the same brush. I'm not for once even suggesting that every hospital in the town was cheating or fleecing the people. However, there were certain instances. As a result, a committee was formulated under the leadership of Dr. V.K. Paul, who's a very eminent doctor and also
but
part
you did
of the
a blanket.
No, of course we did. Let me just finish. Dr. V.K. Paul is a doctor. So first of all, the rates or what all will be included in the price and what all will be excluded from the price wasn't decided either by the political executive or the netas or by the permanent executive, that is the babus. It was decided by a professional, where there was a committee and with active stakeholder consultation. Every hospital in town was invited to have a dialogue with the committee, and after that it was arrived at that the following needs to be done. Now it is, I would beg to differ with some of the comments that have been made by on both sides actually, but I'll begin by saying that look, there is a model of cross subsidy which is inherent in the policy that has been laid down by the government of Delhi. We have said that up to 60% of the beds are to be subsidized or are to be provided at a maximum of the price that has been stipulated by the government. The other 40%, of course, the private hospitals are free to charge as much as they want at the rates that they wish to charge from the patients. So therefore, there is an inherent model so that it's not that the private
you're saying it's cross subsidy. Let me just go across to.
I'll just finish
let me go across to. We're also joined by Dr. Sumit Ray. Raghav, I need to move on. I'll come back to you, Dr. Sumit Ray, Head of Department Critical Care Medicine at the Holy Family Hospital. Dr. Ray, the same question to you that I was asking the other doctors, representatives of private hospitals on the panel, that have you kicked in with the capped prices at Holy Family? And as a clinician, as someone who's hands-on this, not on the corporate side, is it realistic to be able to provide the same quality of care at the lowered rates?
Yeah, Srinivasan, so yes, we have kicked the prices in. And I agree that in this moment of crisis, we need to partner with the government to do the best we can. We will provide the best quality of care. Holy Family Hospital is a charitable trust hospital, and it is not a hospital which charges very high rates as such. But in spite of that, I would say that the price cap for intensive care patients who require much higher level of care, the price cap seems significantly low. Back of the envelope calculation, a quick calculation of what is the minimum amount of money that we need to treat a patient, taking away capex, etc., electricity bills, everything, is around approximately 30,000 rupees.
Yes.
Below that, the hospitals will bleed. Okay, and this is not a hospital. Holy Family is not a hospital.
Okay, 30,000. This is
about approximate ICU patient on the
Okay,
ventilator.
30,000. Just to remind our viewers, approximately. Okay, 30,000. The capped price is between 15 to 18,000. So it's about just half of that.
Yes.
Yeah. Yes. Okay. So you're saying even if you just like strip it down, even if you're just putting up a bed at cost, it will still be at least double what the price is being capped at.
Yeah, and we are not even looking at capex, etc. It's just delivering all the medicines which are required, the salaries of the staff, and just that, that's all.
Right.
Even that would be about 30,000. I mean, that's the kind of ballpark figure that we have calculated. Yes.
Okay. So last word, Malini Aisola, that is this something which you think that regardless of the debate about whether there's profiteering or not, do you think that this is tenable though? This is just a one-time solution or a one-time measure that seems to have been taken, but it's not a tenable in the long run. The long run, you're saying, would require a more calibrated approach to how you come up with this whole concept of pricing versus quality.
So I just want to make a few points. The first is that there has been absolutely no transparency in the decision making. There was no involvement, neither at the central government level nor at the Delhi government level, or dialogue with groups that have actively been assisting patients or have an ear to the ground. In response to what Mr. Chadha was saying, we have actually had to write a letter to the Delhi government regarding the limiting of the price caps to only 60% of the beds, because we feel that is discriminatory and unconstitutional, because it creates two different classes of patients, one that gets the subsidized treatment and the other that has to pay the full hospital rate. So this provides leeway for overcharging even now. And just to respond very briefly to Dr. Ray's calculations about the charges, I think what he might have what he might have missed out is ask him whether there is not a large margin in the isolation bed charges, because that's really where a lot of hospitals are making the maximum profit, and that's also where most of the patients are being admitted.
May I?
Okay, Malini, I'm out of time. I'm completely out of time. Is that Raghav? Is that you?
Yeah, this is me. Yeah. May I just make one final point? I'll just
Raghav, Raghav, I literally have 10 seconds.
Yeah, I won't take more than that. Look, there is a balance that the government is trying to strike, where we ensure that people get good quality private healthcare at an affordable price, and also at the same time trying to see that the private hospitals are not disincentivized to a point where they shut shop. One is trying to maintain a balance so that the private sector as well as the government sector work together and give the best possible care. So I, quite frankly, disagree with both sides. A lot of the points that have been made by both
Okay, we'll come back to this. We'll come back to this. It's an interesting conversation to have opened up though. Thank you all so much for joining us on Reality Check. Thanks so much for watching. Good night.